welcome to the Hormone Café. I'm Dr. Sarah Pederson. I am an OB-GYN and I specialize in holistic hormone balance and fertility. Today, we're going to talk about endometriosis. I want to go over with you what is endometriosis, what are the symptoms of endometriosis, how do you treat endometriosis, and how do you prevent endometriosis from coming back. Number one, what is endometriosis? When we think about our uterus is composed of mostly two layers. We have the outside or the muscular wall of your uterus, and then you have the inside of your uterus, which is much more fluffy. That's called your endometrium. And your endometrium is what grows during your cycle and then sheds when you're on your period. So when we think of an orange, for example, let's pretend that the peel of the orange is the muscular wall and that the fruit of the orange is the endometrium or the inside lining of your uterus that sheds when you have a period. Imagine if the inside pulp, the orangey fruit part, was growing on the outside of the peel. It would look really strange and bizarre. That is what endometriosis is. It's when the inside lining of your uterus actually grows on the outside of your uterus, but it can grow all over. Endometriosis can grow on your ovaries, on your fallopian tubes, on your rectum. It can even grow in places like your diaphragm, up near where you breathe, on other parts of your intestines. Where we find it the most commonly is behind the ovaries, deep down in the bottom of your pelvis, and behind the uterus, where your rectum is, are the most common places to find it. And then related to what is endometriosis is how do you get endometriosis? One frustrating thing is that we really don't know why some people get endometriosis and some people don't. Some people definitely have a genetic component to their endometriosis, meaning they know that their mom had it, their sister had it, they're more likely to have it. But there are a lot of people who have endometriosis and they have no history at all in their family. So there is a genetic component, but it's not as genetically linked as some of the other disorders that we see. There are some theories about how people get endometriosis. One of the theories is something called retrograde menstruation, and that theory is that because our fallopian tubes are connected to our uterus, there's a chance that when we get our period, instead of the blood flowing down the uterus through the cervix, out the vagina, that the blood actually flows backwards through the fallopian tubes and spills into our abdomen. That's a theory, but that doesn't explain. Sometimes we'll find endometriosis in very bizarre places. For example, endometriosis has been found in the lungs. It's been found in the vaginal tissues before. So it explains some of the endometriosis that we find behind the uterus and behind the ovaries, but it doesn't explain endometriosis that's found in other places in the body. The other theories are that endometriosis could be an autoimmune disease or related to other autoimmune diseases, or that it could be cells that are seated in the blood and in the lymphatic system, almost like cancer that spreads, as in the cells inside the uterus can somehow get into the bloodstream and spread endometriosis to other parts of the body. So we really don't know exactly why some people get endometriosis and some people don't. Endometriosis is also sometimes historically considered an estrogen-dominant condition, meaning if you have a lot of estrogen on board, you're more likely to get endometriosis. However, I think that what's closer to reality is that it's associated with a hormonal imbalance. So sometimes it can be associated with high estrogen, sometimes it can be associated with low estrogen, sometimes it's that your estrogen to progesterone ratios are off. So all of those things can create an unfavorable environment where endometriosis can thrive. So what are the symptoms of endometriosis? When we think of the classic symptoms of endometriosis, it's really severe pain on your period. So if you are a person who has really, really painful cycles, you're that person who had to call out of school when you had your period, you and your heating pad are best friends, you and your ibuprofen or your Advil or your Aleve are best friends, you need to have a lot of medicine or a lot of heating pads, you're curling up in a ball when you're on your period. That's kind of the classic symptoms of endometriosis. The other things that are associated with that are, because endometriosis can grow on your bowels or on your rectum, sometimes people get really painful bowel movements when they're on their period. If it's really bad and endometriosis is going all the way through your rectum, sometimes you can bleed when you poop. Or people who have pain that's radiating to their back or both sides or down their legs. When endometriosis is infiltrating into your back or into some of your nerves in your pelvis, that can cause a lot of pain radiating down your legs, especially on your period. Endometriosis is most commonly associated with recurrent pain. That's much worse when you're on your period and better when you're not on your period. However, there are some people that have chronic pelvic pain and their endometriosis causes them pain every single day. The other little signs are there is something called endo bloat, meaning there's a relationship between the inflammation during endometriosis, which can inflame your gut. So people who are really bloated all the time, or they feel like they can't really get their bloating under control, or it's not making sense, that can sometimes be associated with having endometriosis, because the inflammation from endometriosis can be inflammatory for your gut. The difficult thing about endometriosis is that only 50% of people have symptoms. So we talked about the classic symptoms of endometriosis, but 50% of people have silent endometriosis, meaning they don't have any symptoms at all. The number one symptom of endometriosis is pain on your period, but the number two symptom of endometriosis is infertility. So if you are a person who's been trying for 3 to 6 months, your hormones are balanced, you're ovulating, everything should be making sense, and you're still not able to get pregnant, one thing that we really want to think about or keep in the back of our mind is, do you have endometriosis? Because silent endometriosis can prevent us from ovulating well. It can inflame our ovaries. It can disrupt our hormone balance. It can prevent the egg from traveling down the fallopian tubes properly. It can affect implantation. Having those inflammatory cells all over your uterus, ovaries, or pelvis can definitely affect your hormone balance, the way that you feel, your ovulation, and of course affect your fertility. So it's something that we always want to keep in the back of our minds. So let's say you think that you have endometriosis. How do we find out exactly if you have it? The gold standard is that we really cannot diagnose endometriosis unless you have surgery. The unfortunate thing is that endometriosis is kind of like having moles or freckles on your skin. There are these little lesions that are dark or white and look like scar tissue that you can't see on an ultrasound, on a CT scan, on an MRI. Unfortunately, scar tissue and endometriosis, unless it's really, really bad, often does not show up on an ultrasound. What does show up occasionally on an ultrasound are nodules. Sometimes we can see those on an ultrasound. Or if you have an endometrioma, which is a cyst on your ovary that's full of endometriosis, that can show up on an ultrasound. But oftentimes your ultrasound could be completely normal and you could still have endometriosis. So the main line diagnosis of endometriosis is to do surgery, where we have to put you completely asleep. I do surgery robotically, where I put trocars in your abdomen and look around and see if you have endometriosis. There is a test that we do sometimes, which is called myReceptiva diagnosis test. It's actually a biopsy that we can do of your uterus here in the clinic. There's one company that has a patent on a specific type of protein that can point toward endometriosis. So if we're not sure if you have endometriosis, we can do a biopsy to give a little bit more clarity to see if you might be more likely to have it or less likely to have it. So let's say we think you have endometriosis. Once you have it, or you know you have it, or we suspect you have it, how do you treat it? So with all things, the cornerstone of everything that I do is lifestyle, nutrition, diet, sleep, exercise, stress. So that's core number one. When we think about endometriosis, the big thing is that we really want to think about it as lowering chronic inflammation. So that comes from your diet, right? Are you eating anything that's keeping you chronically inflamed? That also has to do with your glucose. So a lot of times I'll have people do a continuous glucose monitor before I'll do endometriosis surgery, because I really want to make sure that once we take out all the endometriosis, they're not continuing to inflame their body. So oftentimes before we do endometriosis surgery, I'll have my patients do glucose monitoring, a gut health test, or a food sensitivity test, or some combination of those things to make sure that we're not inflaming their body or their gut, even though we take out the endometriosis. So we really want to make sure that we're having a low inflammation diet. In general, we don't want to be doing any processed or refined sugar, refined carbohydrates, and then no processed food, because we really want to make sure that we're not having a lot of omega-3s, which is coming from mostly seed oils, and that our omega-3 to 6 ratio is really high and really healthy, because that can help prevent endometriosis from regrowing. So nutrition is a big one. We really want to make sure we're having an anti-inflammatory diet. And then it's always important to exercise and move a bit, because you definitely want to have good, healthy blood flow to your uterus and to your ovaries. But then, of course, you want to get a good night's sleep and manage your stress, because we don't want chronic stress to cause suppression of our hormones, and suppression of hormones can lead to endometriosis growing back. So those are all the things that we want to make sure that we have stable in order to prepare ourselves to manage our endometriosis, whether or not we have surgery. We definitely want to be doing those things. The next step is supplements. So there are a lot of different supplements that can prevent inflammation. Some of the big ones that I use often that have been shown in studies to help with endometriosis specific inflammation is omega-3, NAC or N-acetylcysteine, and then curcumin or turmeric. So I'll often use a combination of those to help the inflammation in endometriosis. So first step is nutrition and lifestyle. Second step is supplements. Third step is medications. It's very important to have your hormones balanced. So if your hormones are horribly imbalanced, sometimes we'll use bioidentical hormones in order to boost your hormones, or sometimes we'll use certain supplements or medications to help your body metabolize hormones off better. So that does depend on what your hormone profile is. I'll sometimes use bioidentical hormones in order to keep your hormones as balanced as possible. And then other medications that we think of are anti-inflammatory medications. Sometimes we can use short-term steroid protocols to decrease inflammation and things like that, depending on how bad our symptoms are. And then the last tier is surgery. So there are lots of people that have really bad endometriosis who can get pregnant even with bad endometriosis. However, it does help to have the endometriosis removed. It really does help with fertility. But whether you want to have surgery or not, you definitely want to think about those other core principles. Am I eating in a way? Am I taking the supplements that are anti-inflammatory? Is there any medications that I need to be taking to make sure that my inflammation is low and my hormones are balanced? And then we think about, should we have surgery or not? So when I do surgery for endometriosis, the really, really important things are, number one, you want to make sure you look and find it all. So when I operate robotically, because it enables me to use these little teeny tiny hands, which means I can be really, really gentle on the body and really gentle on the tissues. So it's as restorative of a surgery as we possibly can have. So I always operate robotically, and you want to make sure you look everywhere and make sure you can see all the endometriosis with a really high quality camera. The other thing that you always want to make sure is, I always make sure, of course, that you excise the endometriosis. Endometriosis, like I said, is like having moles or freckles on your arm. And we don't just want to burn them or fulgurate them is the medical term, because let's say we were trying to remove a mole on your arm. If you just burned it, you don't know if you got all the cell layers all the way to the bottom. So you always want to take a little scissors and make sure you cut endometriosis. And in a way, you think of endometriosis almost like taking out cancer. You always want to get a margin around what you're taking out to make sure that you really are taking it all out. So I go in, I look very thoroughly all around, all the way from your diaphragm, all the way to your bladder. So I put a camera inside your belly button and look at your diaphragm, your liver, your gallbladder, your large and small intestine, your pelvis, your bladder, ovaries, fallopian tubes, uterus, rectum, all over the place to make sure we're not missing any endometriosis. And then I take a little tiny scissors and cut out each individual spot of endometriosis, and all those spots get sent to the pathologist. Most of the time when you see endometriosis, it looks like a mole, almost like a brown or purple or red lesion, but there's different phases of endometriosis. Oftentimes, endometriosis can also look like fibrotic scarring, so white scar tissue. We call that colloquially burned out endo, meaning you might have had endometriosis for a long time. So there's something more like fresh endometriosis that looks brown and bloody, and then there's more burned out endo that looks white and scarred. So it's important to know how all the different types of how endometriosis presents, so you can make sure that we get it all and we don't miss anything. So I go in, I cut it out, and the thing that we have to be careful of is that we don't want to make your egg quality worse. So let's say that you have a cyst full of endometriosis on your ovary. I'm very, very, very diligent about removing that cyst wall very delicately and not damaging the underlying ovarian tissue or ovarian cortex, because you don't want to hurt your ovaries or make your egg quality worse. So that's really important when we think about endometriosis surgery, is just to be very delicate and very gentle and very thorough. So in a way where we're taking out all the endometriosis but not damaging the underlying tissue. The other things that I do when I take out endometriosis is I sew the skin back together. It's called the peritoneum, where I removed the endometriosis. So imagine if I was to take a mole off of your skin. You could just leave that spot open and let it heal, or you could sew the skin closer together. And reapproximating those skin edges really helps with healing and prevents scar tissue from happening. Sometimes I have to take endometriosis out in a place that's so large that I can't put the skin back together because it would be way too tight. So I have a lot of creative things that I do. We use these resorbable polymers. So I'll put down, often I call it a fake skin. So I'll put a fake skin down and lay that over the wound bed or the area where I took out endometriosis to make sure that it heals underneath and that nothing sticks to it, because you don't want to take out all this endometriosis and cause additional scarring. The whole goal is to make you feel amazing, not have pain on your period, be able to get pregnant and not make anything worse. So sewing the skin back together is huge. Putting down an anti-adhesion barrier is huge. There's also a spray that I'll sometimes use. Even if I sew the skin back to closed, I often spray it with an anti-adhesive barrier. And then the last thing I do to prevent scar tissue is inject the areas where I removed endometriosis with something called PRP. PRP stands for platelet-rich plasma. Before my patients go back for surgery, I have the specialist in platelet-rich plasma draw their blood in the preoperative unit. And then what we do in the OR is we spin their blood down to just the healing cells. So platelets are what goes to areas of your body that are damaged. So we take those platelets in plasma, which is the liquid part of blood, and then I can inject those healing cells from your own body into where I removed the endometriosis, which promotes healing and prevents scar tissue. So it's very regenerative. So then I take this little teeny tiny needle, and all around where I removed endometriosis, I inject PRP to really help with healing. And I've been having fantastic results with that. So when we think about treating endometriosis, it's that combination of using a surgery that's very thorough, very diligent, excising the endometriosis without damaging the other structures, and then really making sure that I'm doing techniques where the endometriosis is not going to grow back and scar tissue is not going to form. So there's a lot of things, little techniques that I do to make sure that we're restoring your anatomy back to its beautiful, normal, and lovely self. Then I tell my patients that if you have surgery, it's only the middle of the journey. It's not the end of your journey. I'm going to make you do a lot of homework after your endometriosis surgery to prevent the endometriosis from coming back. This is very important. So we used to think that in the matter of 3 to 6 months were the most important times to make sure that endometriosis doesn't come back. However, newer data is coming out that endometriosis has long-term benefits on your fertility for up to 1 and 2 and 3 years into the future. So even just having one surgery can help your health and fertility for many years to come. Things that I do after a patient has surgery is that I really have them be on a little bit stricter anti-inflammatory diet than they're usually on. And then I usually have them on a number of anti-inflammatory supplements, sometimes medication or anti-inflammatory medication, just depending on how bad their endometriosis was. And then I use a lot of bioidentical progesterone because there's good data to show that if you take progesterone after you have surgery, then it can prevent your endometriosis from growing back. And the great thing is that we do that all physiologically. So we're not trying to shut your body down or suppress it or give you a medication that's just going to shut it down. We want your hormones to come back. We want your egg quality to go up and your eggs to make beautiful and lovely hormones in a cyclic fashion where you're ovulating and you're feeling great for cycle over cycle over cycle. So right after surgery, the hope is that your hormones will bounce back and your periods will start getting less and less and less painful, and then it will really optimize your fertility. So when we think of endometriosis, we talked about what is endometriosis. We talked about what are some of the symptoms and how it's diagnosed. And then I went over some of the detailed things that I do as part of my protocol here at Vera Health and Fertility to not just take out endometriosis, but look long-term into the future so that it doesn't grow back, it doesn't cause scarring, it makes us feel amazing every single day and improve our fertility for the future. Thank you for joining us today at the Hormone Café. If you are worried that you might have endometriosis or you want to talk about it, we can make a really specific plan for what we need to do for your specific body to really decrease inflammation. Go ahead and make an appointment with me. Our website is verafertility.com. And next on the Hormone Cafe, we'll be talking about endometritis, which sounds a lot like endometriosis, but is completely different and can be very confusing. So stay tuned. Thanks for joining us today on this episode of the Hormone Cafe.